Hi, Mike Gibson, Leslie Cho, the Cleveland Clinic Foundation. We're here talking about analyses from the CLEAR Outcomes study. A lot of presentations this year at ACC, Leslie, talking about women. I got to tell you, congratulations. One of the few trials to enroll half or more than half the patients is women. Great job there. Hispanic patients and also the obese patients. Give us a quick wrap up of what you found.
Yeah, thank you so much for having me. So, Clear Outcomes, as you know, the main study was published in 2023. It enrolled 13,900 patients who are statin intolerant. And these are the sub-studies from that Clear Outcome study, which overall showed an improvement um, with bempedoic acid in terms of lowering major adverse cardiac events. So we're very, very proud of the fact that Clear Outcomes had the highest enrollment of women in modern day contemporary trials, 48% women. And that what we found was that women were older, they were more likely to have higher levels of LDL, more comorbidities, and they derive similar outcome benefit as men receiving bempedoic acid. And that's actually very encouraging because women were able to take bempedoic acid with similar rates of intolerance as men. So there was no greater intolerance in female population. So the drug works and it works well without increase in side effects. The other clear outcome study that was released at ACC was the Hispanic subpopulation. And as you know, Hispanic population makes up the fastest growing minority group in the US. And Clear Outcomes enrolled 17% Hispanic or Latinx patient population. And again, it showed a 21% lowering of LDL. And similarly, it confirmed that cardiovascular risk reduction with lowering LDL and good tolerability with bempedoic acid. And then finally, a very exciting sub-analysis from CLEAR on the obese population. So nearly 45% in CLEAR outcomes had BMI greater than 30. And those patients derived particular benefit. They were 23% less likely to experience MACE if they were on bempedoic acid. So overall, I think this is a sort of an exciting sub-study from the Clear Outcome study showing that whether you're a woman, whether you're Hispanic or in the obese population, that the drug works and is well tolerated.
Was there a positive interaction term in the obese patients? I mean, did it significantly modulate the treatment effect?
No, they derived just as clear benefit with bempedoic acid. I think what's sort of interesting with the obesity subset analysis was that we think about we're so I think immune in America to think about obesity now because we think about obesity as BMI greater than 35 or whatnot, but these were like um, BMI greater than 30, which if you think about it, it makes up majority of Americans actually. And so this I think is a good drug to use in people who are statin intolerant. Obviously, this is not a drug um, for people who are statin tolerant, but for people who are statin intolerant, who can't get to goal, who need another 30% LDL reduction, I think this is a great drug to use.
And how did you manage to enroll 48% women?
You
What's the
know,
secret?
Yeah, that's a great question. I think, oftentimes we think women don't want to participate in trials, and really that's not true. I think when we have trials that really sort of address the questions that are unique to our female patients, and as you know, Mike, statin intolerance is a very much a female problem. When you look at large registry data. When you look at clinical trials, women have more statin intolerance. So having a trial that addresses patient really centered questions, we're able to enroll lots of women.
Great. Well, good to hear. Great work. Congratulations on all the hard work getting all that information out. Thanks for joining us today. And thanks to all of you for joining us here for this ACC wrap up. Thanks.
Thank you so much.